Hi everyone, I'm Dr. Z, and we're going to be learning about autism. I myself am on the spectrum, considered a level 1 diagnosis, and I have a bachelor's of science in biochemistry, a doctorate in naturopathic medicine, and I practice functional medicine. I work with mainly neurodivergent individuals, whether that is ADHD, autism, bipolar, schizophrenic, and beyond. I'm very excited to be taking you through what living on the spectrum looks like, the invisible struggles and the unseen strengths, and redefining what autism is in today's world. This series on autism is going to go through the historical evolution. We're going to go through what lived experiences look like. We're going to go through some biological factors, and we're going to go through some clinical applications and recommendations that can help people on the spectrum. This is going to advocate for a paradigm shift in the clinical understanding of autism, and it's going to integrate autistic lived experiences with scientific research to foster a more equitable healthcare delivery in our practices. Some concepts to know about autism. Allistic is a person who is not autistic but may still be neurodivergent if they have other conditions. So anyone who is not autistic, the word used to describe them is allistic. Neurodivergent is where neurological development and functioning is different from societal norms. This is a term of exclusion. Neurotypical is where neurological development and functioning are considered normative and within the standard range of human cognition, behavior, and social interaction. It's often used to describe people who do not have conditions such as autism, ADHD, or other neurodevelopmental differences. Neurodiversity is just the general neurological differences between everyone. This is a term of inclusion. This is what is describing our natural variations of human function and not inherently disorders. Stimming are repetitive behaviors or movements like hand flapping, rocking, vocalizing, which can be done in different forms, whether it's like it just feels good. It's self-soothing. It's a way to self-regulate, manage your sensory experience, and express emotions. And we're going to get to why some people on the spectrum do this. At least speaking for myself. Ableism is discrimination or prejudice against individuals with disabilities. And this can include other neurodivergent people too. And it's often based on assumptions of neurotypical superiority, meaning that because there is a current standard of behavior that people are expected to model after, when a person cannot model after that, they are shamed, bullied, all kinds of things, and that would be considered ableist because people assume that people are choosing not to behave a certain way or to behave more neurotypical when actually many times that a person can be disabled from that. For example, I don't hear tone. I have an auditory processing difference, and people may assume that I'm speaking or hearing things on purpose a specific way, but I actually don't know how I sound. I can't hear my own voice for the most part. And so when I say things in a tone that other people hear, they assume that I am doing that tone on purpose, but I actually have no idea that I'm saying something in a certain tone. A lot of times, any of the tones that I use are just me mimicking a previous tone I've heard and not knowing that that tone has different implications. And because that conversation doesn't happen or curiosity, ableism occurs and that judgment. Currently, as it stands, in the Diagnostic Statistics Manual, aka the DSM, which is the Bible of psychiatry, what is used to diagnose people, for the autism spectrum disorder, there are 3 levels that are used in the diagnosing process. Level 1 would have formerly been referred to as Asperger's syndrome. And it is where you require support. So you may have difficulty initiating social interactions and you can maybe function independently with some support. Level 2 is where you require substantial support. So there's marked challenges and social communication and restricted behaviors impacting daily life. And level 3 requires very substantial support where there are severe challenges in communication and significant support needed for daily functioning. And a lot of times there's a lot of co-occurring conditions that make level 3 autism much more profoundly disabling as well. Note, we do not use terms high functioning or low functioning. We use level 1, 2, and 3 currently. The terms high functioning and low functioning have been related to eugenics language. So that is something that we don't use. And I know that that's something we used to use in the past, but currently we no longer use that verbiage. And we also no longer use the term Asperger's. And then the term unmasking. So these are just like popular terms that are being used today that I wanted to go over just to begin. The term unmasking is the process of reducing or stopping masking behaviors to express your own authentic neurodivergence. And that can look like stimming openly or communicating naturally. And I like to think of unmasking as internalizing pain. It's like, if you're having trouble, but you're smiling through it, like that would be considered masking. And unmasking is no longer just internalizing that pain, but actually sharing it or expressing it and not hiding it. And a way a lot of people don't even know they're masking, which is a really interesting phenomenon as well. Something that I also went through myself in discovering. But that's a story for another day as we continue on.